Before we talk, I want you to take a close look at these pictures and pay attention to the baby's head, all right? Okay, I believe by now you might have seen the different shapes of the baby's head. These things are common and it happens during labor. When you are in labor as a woman, there are so many protocols that you need to observe. And such things happen in a case of prolonged labor or a difficult labor. Sometimes, when it is time for a woman to push, especially during second stage. You know, second stage of labor is one of the shortest period in labor, and you don't need to waste time, because when you waste time at this stage of labor, this thing can result on the head of your baby when the baby is born. You know, most of the time, women complain that midwives shouted at them when they were in labor. Some midwives may not be patient enough to tell you to push your baby the way you ought to push your baby, because when you delay in pushing out your baby, these things can result on the head of your baby when that baby come out, because this thing come as a result of pressures mounted on the head of your baby when the baby is trying to come out. So when you are delaying in pushing out this baby, this pressure can cause this swelling on the head of your baby, and when this baby is eventually born, you will see the shape of the baby coming out this way. So when you are in second stage of labor, try to push as if you are pushing out a hard stool. Don't waste time, so that these things cannot result on the head of your baby. I know many of you will complain that midwives are usually aggressive on you when you are in labor. It may be as a result of delay during second stage of labor, and sometimes it can be due to prolonged labor. So when your labor has extended beyond the normal duration of labor, I told you that irrespective of the number of children you have given birth to, your labor should not exceed 12 hours, and it should be lesser depending on the number of children. If you have given birth twice or 3 times, your labor should not exceed 8 hours. I said maximum 12 hours so that you will not have a prolonged labor. So bear it in mind, once you enter active stage of labor, those periods that contraction is coming more frequent, you have to keep your times at alert so that you will know when the next action is supposed to be taken. Okay, you need to be carried along when you are in labor. Don't just leave everything for your midwife or your healthcare provider. You have to be active. Go to your labor with a companion so that when you are exhausted, someone beside you can take over from you. And the main thing, being the second stage of labor, please don't waste time. Push as if you are pushing a hard stool when it is time to push. Don't delay, so that your baby will not come out with such swelling, such an abnormal shape, which will make you not to be happy when you see your baby. It takes some days before these things clear off, although it doesn't be of any harm to the baby, but you will not be happy covering your baby's scalp all the time because of the abnormal shape the baby came out with, which may be as a result of difficult labor or a prolonged labor or lack of cooperation between you and your healthcare provider. So listen to your healthcare provider, especially during labor. All right, don't be carried away by the pain. I know it can be very painful, but when you cooperate, the pain will be minimized and you will come out safe and successful. All right, don't forget that this is your favorite midwife, Joy aka Lady Ago. Enjoy yourself and do have a wonderful day. See you on our next video.